Hi everyone, welcome to my Nclex review channel. And because this is an exam review channel, we will be going through the most important things you need to ace the new Nclex exam, the new generation Nclex exam. In our classes, we will be looking at illnesses and complications as it relates to the system of the body. So, in other words, we will be doing our review based on the systems of the body. So, for instance, if we are talking about the cardiovascular system or the respiratory system, we will look at the illnesses of such systems. Say the respiratory system, will look at illnesses like asthma, what causes it, the signs and symptoms, and possible treatments. So today we will start with the cardiovascular system. The cardiovascular system is sometimes intimidating and confusing, but we will try to make it as easy as possible. To understand the cardiac system, its illnesses or complication, understand the signs and symptoms, identify the causes of such complications, and propose a possible treatment, it's important we understand how blood circulates through the body from the heart. And to understand that and make it easy, I use two words. They might mean the same thing, but I use these words to kind of make it easy for myself to understand it. And it really helped me while I was studying. So I use circulation to mean oxygenated blood going through the whole body from the heart. And I use flow to mean deoxygenated blood going back into the lungs. So the blood from the upper part of the body comes through the superior vena cava, and the blood from the lower part of the body comes through the inferior vena cava, and the both of them will dump into the right atrium. The blood will pass from the right atrium through the tricuspid valve into the right ventricle. The blood will go from the right ventricle through the pulmonary valve into the pulmonary artery, and from the pulmonary arteries into the lungs. When the blood gets to the lungs, it becomes oxygenated. The oxygenated blood will come back to the heart from the pulmonary vein into the left atrium. From the left atrium, the blood will pass the mitral valve into the left ventricle, and from the left ventricle, the blood will pass the aortic valve into the aorta, where it descends down from the aorta going towards the lower part of the body to be circulated throughout the lower part of the body, and the one going up to be circulated throughout the upper part of the body. So to simplify what I said in a layman's language, I actually like layman's language. The heart is divided into 4 chambers, the left side and the right side. As far as the chambers goes, whatever is on the right side is also on the left side. So you have the right atrium, you also have the left atrium, you have the right ventricle, you also have the left ventricle. And as far as knowing the valves, you actually only have to memorize or know 2 valves, the tricuspid valve and the mitral valve. The tricuspid valve is the valve on the right side of the heart. So as soon as the blood gets to the right atrium, the valve it will pass through will be the tricuspid valve. Now, the pulmonary valve, the blood is going to the lungs through the pulmonary artery. So the valve it will pass will be the pulmonary valve. And the blood going to the aorta will pass the aortic valve. So If you remember the aorta, you know the blood is coming through the aortic valve. If you remember the pulmonary artery, you know that the blood is passing through the pulmonary artery. So the two things you have to worry about will be the mitral valve, which comes from the left side going into the left ventricle, and the tricuspid valve, which is on the right side going into the right ventricle. Okay, this will bring an end to the class for this topic. I hope you were able to learn something. You were able to take away something from today's class. Please don't forget to like, subscribe, and tell your friends about our channel. Thank you very much.